Today we're going to talk about a leaning trunk. Specifically, those of you that might be leaning towards your uninvolved side. We're going to go over what I think are some of the reasons or some of the things that might cause this after damage to your brain or your spinal cord, as well as some exercises to help combat some of the most common reasons why this might be happening. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we cover anything and everything related to neurologic injuries as it relates to movement and recovery, with the end goal of empowering you to take a little bit more control of your neurologic rehabilitation program. And that being said, we are going over what I refer to as an abnormal movement problem or walking problem that can happen as you are in the stages of motor recovery. So, what are some of the things that might cause you to lean towards your uninvolved side? And it's actually a pretty common problem. Now, the things that usually go together with someone that's leaning towards that side is not only do you lean to the side, but you also may kind of bend forward a little bit, primarily when you're standing on your involved leg. So what are some things that might cause this to happen? Well, the first things that come to mind, of course, is probably some combination of spasticity, abnormal movement synergies, and or weakness. And there is probably a small component of each one of these if you have had damage to your brain or your spinal cord. So I'm going to kind of break it down as to what I think might be spastic, what I think might be weak, and what abnormal synergy patterns might contribute to this side bending to help you not just with the exercises that I'm going to give at the end of this video, but also to help you kind of sift through the plethora of exercises that you see on Instagram and other social media platforms. So the first thing that comes to mind, and is probably the most obvious, is that the muscles on the outside of the hip are weak. So what happens when you lift up your uninvolved leg? You've gone from 2 supports to 1 support, so that hip will drop, which will give the illusion that you're bending toward that side. That is as far as the weakness component. Now, there's one other thing that I usually see with this specific movement problem. Many times people will rotate their body towards their involved side. So it's kind of hard to see from the front because when you're looking straight on, it's very obvious that you can see the shoulder dropping, but the rotation is a little bit more subtle. And the reason for that is just that the muscles that on the outside of the hip that abduct the hip, they also externally rotate the hip. So if those muscles are weak, that hip will internally rotate, and it'll also possibly cause you to rotate your body towards your involved side. Now, I promise you that is really important because of some of the ways that I'm going to have you position yourself when you're doing the exercises. So, side bending, one potential cause is weakness in the hip opposite the side that you're bending towards. Now that's the weakness component. What about spasticity? What are the muscles that I think might have spasticity in them that will also contribute to this? And for those of you that are new to this channel or you haven't been following me for a long time, I've talked a ton about spasticity. Spasticity is an involuntary muscle contraction. So the muscles that are most likely spastic with this pattern are the calf muscle, or the muscles that point the foot, the gastrocnemius, the soleus, and the posterior tibialis. I talk about all 3 of those quite a bit, and oftentimes I talk about them together because they're usually all part of the problem if you have spasticity in your lower leg. Now, why does that cause you to lean forward and away from the weak leg? Well, when you're standing on that leg, if you get an involuntary contraction in those muscles, they point the foot and they supinate the foot. So you roll to the outside of that foot. So what that does is it pushes you backwards and it pushes you towards your weak side, which will cause you to bend towards the uninvolved side and bend forward. Very important, because again, it's gonna make you understand the exercises and select the exercises that are the most appropriate for you at the end of this video. So gastrocnemius, soleus, posterior tibialis, most likely those are spastic if you have this specific walking problem. The other thing is abnormal synergy patterns. So I usually see this type of a posture with walking with someone that has an extensor synergy pattern. So an abnormal synergy pattern, specifically an extensor synergy pattern, is when multiple joints move at the same time or move together. I will link a video going over an abnormal synergy patterns in the description below for any of you that are new. But if you have an extensor synergy pattern, most likely you will see that trunk side bend away from the weak leg. Now the reason for that is that the knee hyperextends when you're standing on that leg typically if you have an extensor synergy pattern, and the legs adduct involuntarily. So the legs come together. So if you envision those two legs again, you lift one leg up. If you are in an extensor synergy pattern and that knee is extended, that's gonna throw you backwards. So you may flex forward, and then the legs are gonna adduct, come together. So that's also gonna cause you, or could potentially cause you, to side bend away from the weak leg. So once again, stand in front of a mirror or walk towards a mirror where you can see yourself, or have someone videotape you if you notice that you are side bending away from your weak side when you're standing on your weak leg. Most likely you have some combination of the three problems or impairments that I just talked about. So what is the solution? So as far as the weakness goes, strengthening. You want to strengthen the hip abductors. So you have a weak muscle, you want to isolate it and strengthen it. So this is a hip abduction exercise in tall kneeling. Now the benefit of doing hip abduction, or working those muscles that move that leg out to the side in tall kneeling, is it takes you out of an extensor synergy pattern and really further helps you to just isolate those muscles that move that leg out to the side. Now for this exercise, I would do it on both sides. So if you have hemiparesis and one side is weaker than the other, I would do it moving the weaker leg out to the side, but also working the stronger leg, or working that stronger leg out to the side. In both cases, you are working the muscles that move the leg out to the side on the other leg. So again, do this both ways. Now always start with your foot on the mat or staying down. That's the easier method. That'll help you just kind of learn how to feel that movement a little bit, and then progress to lifting the whole leg up off of the bed, including the foot. So again, this is the easier version, keeping that foot down when you bring that knee out to the side. Again, that's the easier version. And again, also you want to do this on both sides. So when you're on the weaker leg and you're moving the other leg out to the side, it really takes a lot of strength in those hip abductors to stabilize yourself. So again, do this on both sides. The key when you're doing your uninvolved leg is to make sure your belly button gets somewhat lined up right over your knee, so that your center of mass, your center of gravity, is directly over that knee, and move that leg out to the side. Again, starting with the foot down and then progressing to lifting the whole leg up. Now, what about the spasticity? If you have involuntary muscle contractions in the muscles that point the foot down, you really need an ankle foot orthosis, or you really do need a brace on your foot. There is no way to overcome this. Spasticity, to date, there is no cure for spasticity, but what we do know is that the longer the muscles are, the more lengthened they are, you will it won't be as easy to trigger that involuntary contraction. So the way to keep those muscles long is to have a brace. The other thing that it does, and in this specific situation, my suggestion in working with the orthotist, or something I might ask the orthotist to do for me, is to put the brace in a little bit of dorsiflexion. So if the brace is in neutral, then there's a good chance that that is going to push you backwards. If you can put the brace in a little bit of dorsiflexion, it'll push your body weight forward, so you might not have that compensation or that lean away from the weak leg. Now, as far as that extensor synergy pattern, the big culprit, if you have an extensor synergy pattern, is that the knee hyperextends, pushing you backwards, and that adduction. So for this, you would still need the brace on your ankle, because you want to break up that component of the extensor synergy pattern, so you don't want the foot to point. And then a knee cage. I talked about it last week in last week's video. It is a brace that's specifically designed to prevent you from going into hyperextension. So if you can visualize that, if you go into hyperextension that pushes your weight backwards, that is going to cause you to almost look like you're bent forward and leaning away from that side. So some combination of an AFO, ankle foot orthoses, and a Swedish knee cage or a brace to prevent hyperextension. Now that's the non-exercise solutions that are almost essential, necessary to combat the spasticity and the abnormal synergy patterns. But there's another way. So it's not all hope is lost that there is no cure for spasticity. What you want to do is you just want to get more voluntary movement back. The more voluntary control you have and the more normalized your movement patterns are, the less those abnormal patterns and involuntary muscle contractions can emerge. So you want to practice, standing and walking with as normal a gait pattern as possible. Now, of course, when you have all these other problems going on and these involuntary contractions, that's really hard to do. So what I'm going to talk about now is ways to position yourself to minimize going into this abnormal synergy pattern in standing. And so for this, you are going to need to use some furniture around your house, but the best way to do this is to somehow create some kind of a border on the outside of the leg, or something to stop your hip from going out to the side. So stopping that hip from going out to the side is a way to normalize your walking or regain a normal movement pattern. So for this activity, what we're trying to do is create structures to provide a little scaffolding around our body to prevent some of the side bending and or rotation from going on. What you're doing in this case is you're giving your brain and your body the experience of what it feels like to have everything lined up, and then holding it lined up is where you develop that motor learning or that motor training component, so that you can help keep it there when you do carry this over into walking. So really just standing in place is the beginning step of figuring out how to engage the muscles in the leg to keep the hips level and prevent the hip from going out to the side. So a sturdy structure on the involved side of the body is the first component of this. So even if you can't use your involved arm, that's okay. Right now, all we're trying to do is learn how to shift the center of gravity over one foot. That is step one with any single leg standing activity, or I use this for a lot of different what we call pre-gait activities, or activities that are good to practice before you actually start walking, and that is just a weight shift. Now, a lot of times people know that they need to get over, or my patients a lot of times know they need to get over, but what they'll have a tendency to do is just move their hips over and keep their upper body still over here. And you can see that's actually creating a little bit of a Trendelenburg gait right here, or Trendelenburg position. So you really want to make sure you keep your body aligned and you're moving your center of gravity in a vertical line over the involved leg. That is step one, with your belly button as close to the center of the foot as possible. And then the second component of this, because of course that's still not going to really prevent those shoulders or that body from bending away from the involved leg or towards the uninvolved leg. So now, because you have this strong arm over here, we are going to put it to some use, and you are going to put something in your arm. Now I know I talk a lot about not having anything in the right arm or a single-handed device, but in this case something one-handed does come in handy to help finish or complete that scaffolding around the body to help keep that alignment. And then you can start unloading the uninvolved leg, or in other words, loading the involved leg by just lifting your heel. So we're going to start out very basic, and you're just lifting your heel. Your focus is that your shoulders aren't dropping to one side, or that left shoulder, or I keep saying left, or that involved shoulder is not coming forward. So you're doing a shift and a heel lift. Shift and lift the heel. Shift and lift the heel. And sticking with the uninvolved arm on something to keep that shoulder up, stabilizing surface over on the involved side. Now you can try a toe tap, right? For this one, you don't even need that involved arm. Tap, shift and tap, shift and tap, shift and tap, and forward and backward stepping. And you can do this all day long. Remember, the keys to this are we're trying to learn how to shift, get the center of gravity over the involved leg, unload the uninvolved leg without that hip popping out and that shoulder dropping. So, device in the uninvolved arm keeps those shoulders level. Structure over here helps to keep that hip in, keep those hips level, and step. Now eventually you do want to remove the tools. My suggestion would be to remove the arm tool first and keep this over here. So you can still get that shift, you still get a little bit of assist or a little bit of support from that chair. And work on that stepping. Now you're really going to want to pay attention that that shoulder's not dropping. And then start with those heel lifts. Unloading that uninvolved leg. And then progress to the stepping. So remember I mentioned that rotational component. This one is something you're really going to have to pay attention to and almost have maybe another set of eyes or someone that can point this out to you if you're doing this, and really just cue yourself or delegate someone to help cue you to do this, keeping that shoulder back. So the strong side or the uninvolved side, the side you're holding onto that assistive device, you really want to focus on keeping that shoulder back. What that does is that's just going to engage those abductors, those hip abductors on that involved side. And again, normalize your movement pattern of keeping your body in proper alignment. And then what do we always talk about? Rewiring the brain is just repetition, repetition, repetition. And you just do it over and over and over again. Now, different from a lot of other videos, I've really only given you really one exercise in this video. And that is done for a reason. Rewiring the brain. You want to create a new pathway. So you can't just do 3 sets of 10, and I still get this question quite frequently on the videos. I'm not a numbers person. Reps and sets aren't really going to get you to your goal. You've got to spend hours a week in these positions to rewire the brain, to regain control, and develop a new nerve network around this pattern. So I hope that was helpful. It was inspired by a comment. Someone was confused on what videos to look for. Is this circumduction? Is this Trendelenburg? You know, and calling out all these different things. And it was hard for me to answer it because it is so complicated and there's so many factors involved with this specific problem that depending on the person, it's probably a little bit of everything, a little bit of just bits and pieces in a lot of different videos. So hopefully that made sense. Hopefully you guys can incorporate this into your standing program. If you have any other specific movement problems, leave those in the comments below, because I'd love to make a video specific for your movement problem. I enjoyed spending time with you all today, and I will see you in the next video.
All the good times just begun.